Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We got Victoria in here with us this morning, and Victoria drove 3.5 hours to get here. And she comes in here complaining primarily of low back pain that in the past has radiated down her right hamstring, but not anymore. She also complains of upper thoracic and mid-thoracic tightness, occasionally pain. She gets some left rib cage pain that goes around to her sides. It doesn't go up into her sternum, but she does feel rib cage pain on the left. Neck pain and stiffness and headaches about 3 times a month, you said, right?
That's right.
And she gets some cramps and spasms as well, which most people with spine issues do get those. We've already done her history and examination. Was that thorough, by the way?
Yes, sir.
Victoria?
Mm-hmm.
Okay, good. So this is her first adjustment here at our office. She's been adjusted by other chiropractors before, correct?
Mm-hmm.
And what made you decide to come here and get this treatment versus what you've had in the past?
I haven't really gotten relief in the past from other chiropractors, and you have some techniques that I
Are
think
different.
Yeah, they're different, definitely different.
Mhm.
I'm hoping to.
Well, she's getting to experience that for her first time today. So let's lay you on your stomach now, Victoria. Back on your tummy. Face down in there, please. So again, we did orthopedic neurological exams on her, and she's good. Reflexes, 2 + 2 = active. 5x5 strength on both sides, upper and lower. Now she has a right leg coming up short here by about 1/2 inch in this position. When I bring her legs up, however, they get even and even a little longer on the right, and that tightens up in her lumbar spine, doesn't it, Victoria?
Yes.
Right in here.
Mm-hmm.
So that's a positive Deerfield and Knockless test, orthopedically. So I'm going to start off adjusting her right SI joint, which is the major subluxation in her pelvis. Sacrum, and here straight P to A and superior to inferior. Now she brought her MRIs down here that I've already reviewed those reports, so she's safe to adjust. There you go. Okay, just keep breathing. Atta girl. There, okay. Let's see if that evens your legs out, Victoria. Legs are now even. Tell me if this feels any easier yet.
Oh yeah.
That feel less tight that time?
Very.
Cool. Okay, you're gonna feel your head popping up on this next one. Okay, let's turn you on your back now, please. So far, so good. Yep, just like that. I'm gonna bring your whole head up and over your spine where it's supposed to be. Yep, now slide down this way about 1/2 inch and put both arms out like this. So she's had rib cage pain on that left side. I've adjusted her ribs posteriorly where they articulate with the transverse process of the thoracic spine. I'm adjusting her anterior rib cage now. You can relax your hands right there. Let this right leg go in my hand like you're sleeping. Atta girl. You should have felt that from your knee all the way up to your lower back, did you?
I did in my low back.
Good. Let go of this one. Atta girl. I'm gonna make you a little taller. Can help you up. Face that way, please. See how that had the little skip jump to it right there?
I did.
Right there.
Uh-huh.
So I'm gonna adjust your glenohumeral joint. There you go. This one's not doing that same thing. Do you see that? You feel that?
I feel that, yes.
I moved the shoulder around while I'm palpating it so I can feel if the joint's dysfunctional or not. Okay, let go. There we go. Yep. Yes. Good. Okay, let's come over on this table next. This is Victoria's very first ring dinger adjustment ever, right?
Right.
Never had this done before, huh?
No,
But you've seen it on YouTube a few times, right?
seen a few videos.
Well, that makes you a crack addict, you know, Victoria. Slide, there you go, down about 1/2 inch. There you go. Now just let your legs relax. The table's gonna lift them up. Have you started trying to sleep like this yet? With your legs elevated?
Sometimes I use pillows to prop my legs or.
I
put
hear
in
that all the
between.
time. When you use pillows, your knees usually bend because you're not parallel. And when you bend this knee, it rotates your SI joint too. So you got to get a box or a clothes basket or something more solid to hold that. You can rest these guys here.
It's just the advice that my mom gotten from like therapists. So.
Okay. Well, having your legs elevated is good advice, but I just don't recommend pillows because it doesn't hold them parallel. Okay, let me get this around your skull and around your mandible. You want to take a nice deep breath through your nose. Look at your right ear. Atta girl. Do you feel that all the way down,
Absolutely.
Victoria? Good.
I did not think it was gonna be like that, but you did get it.
Yeah, good. I always get it. Let me have you here. I got you. Breathe. Atta girl. Tilt right. There you go. Doesn't get any better than that for your first adjustment.
No, it's pretty amazing.
Good
I haven't
deal.
even had other adjustments on my neck like that.
Okay, let me help you up here. This way. You always want to get up sideways like that. If you sit straight up, the vertebrae slip backwards. That's called retrolisthesis, just opposite of what your L5 is doing, going anterolisthesis.
Okay, to get down?
Yeah. Okay, have you stand over here in front of the mirror again.
All right.
We're going to reevaluate your posture. We'll take a look in the mirror already.
I feel great.
You're standing up straight.
Wow.
I'm going to stretch these muscles out. Okay, now I'm going to show you your homework. This does come with homework. Your head's forward, which is pulling your shoulders forward, which is increasing the gravitational weight-bearing compressive stress all the way down. So hold these guys up and back.
Okay.
Flare these here. See how it tightens up that trap? This is the hard part. Your head's forward, but we're gonna come straight back this way and then like this. You're gonna feel a little tap on your atlas there. Another one there. Now relax. Now, when you do that again, this should feel smoother than the previous ones. Try it, see? Did that pull as much on that one?
No, it feels good. It feels better, way better.
You kinking up when you go backwards at all?
No.
Take a look in the mirror right now. You squared off like a military woman.
I am. Whoa.
Pretty cool, huh?
It is very cool. Yes. This is great.
So, Priscilla, this is your very first adjustment here at our office. What would you, or Victoria, I'm sorry, wrong name. What would you tell our other crack addicts worldwide about your first experience here at the office?
I would say if you're having pain, do your research and maybe you will find that Dr. Gregory can do some adjustments and you'll find relief.
Yep. Well, thank you for sharing your experience with everyone, Victoria. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see y'all soon.